So first of all, just please introduce yourself, what you do or recently did, and
Yeah, no, I'm Mark Wallace. I'm a family physician by my first training and a public health practitioner by my second or third training or whatever it might be. And so have recently served as the director of a local public health department in Colorado, in Will County, while also working in medicine in a limited way, not practicing full time, obviously, and working to try and create healthy communities. So a
yeah,
little bit in a lot of different places.
it's nobody would ever accuse you of being unambitious
Uh,
in your
keep
goals.
yeah. I've had a lot of goals that I keep pursuing. They're goals that keep me getting up in the morning because they're exciting things to be involved in, and it's a privilege being I've shared with others as I've come through these recent months, in particular, the privilege of being a physician, number one, of the places where we put ourselves in a position of wanting people we serve to trust us, and the tremendous work that we get to do, and so it's a privilege to do the work and to have people want to share in this kind of work together. So that part of it continues to get me up and gets me excited to go and do things. As not, I can't do them as much. I'm mostly in front of screens like this right now, but obviously we still have to go into the clinic and do things clinically that are back in the old ways, except we're wearing a lot more masks.
So are you still doing some clinical care too, some practice?
I do a little bit of practice. I've kind of narrowed it down so that I don't, it's not easy for me to do a continuity practice.
Right.
So I tend to do my work more in some focused areas and in some procedure areas, where it's easy for somebody to refer somebody to me.
Mhm.
I can engage for a certain period of time, and then I can hand it back to a primary person. So
Mhm.
that part still keeps me getting to go into the exam room and close the door and realize what that's like.
And what that's
And,
about.
and, and it's
That's
rewarding. Yeah.
yeah. In my whole career, it's been this. No matter what I've done, I'm not seeing patients anymore, but
Hmm.
um, that's always been so important to have
Yeah.
the boots on the ground and
Yeah.
yeah, and to be grounded in what I'm doing.
Yeah. Absolutely.
Um, okay, enough chit chat. How's it been? So you recall when you first heard of the pandemic?
I was trying to think about that the other day. I love to journal. When I get really busy, I don't do a good job of staying on top of it. And then I will suddenly sit down for a Saturday and, journal for, a broad period of time. And I was trying to remember when I first heard about it. I recall that I took some time off in December of 2019 and went to have us all gather in Hawaii, where my oldest daughter and her husband live. And so we were there for the holidays. And I remember having some conversations about public health and infections and all this kind of stuff. I can't remember whether we ever mentioned the word COVID.
Mhm.
Um, and then suddenly it was in about middle of January where I can remember, things, specific conversations starting to happen around COVID, and then beginning to look back and go, oh wow, look what's been happening.
Mhm.
Certainly, what's been taking off, in China, and then what's everybody saying about this. So it's not the same as sort of when a shuttle blows up with astronauts on it, where you're like, oh, I remember where I was standing at that exact moment. I don't have that same recollection with COVID. Um, it was one of those, especially working in public health, where we spend a lot of days worried about infectious diseases and communicable diseases. And so there's always some conversation going on somewhere about, oh, what's happening with tuberculosis? Or, oh, you know what, here's what's happened again. It's the season we have to start getting worried about this popping up or that popping up. And how's influenza doing this? So it got a little bit lost in some of that.
Mhm. Um, what how did you sort of get the news that it was a big deal?
When I and the folks I worked the closest with began to say, you know what, we need to be sitting down specifically to talk about this. This is no more just monitoring. Is when we started to see what Washington State was going through,
Hmm.
and you begin to hear uh, the challenges that are coming up. You know, this is rapidly evolving, and hospitals are suddenly talking about what's happening to them, and you're starting to see folks, you know, in a big city trying to react from public health across to healthcare. And so when that was really going on, I know that I really took attention and started having conversations with colleagues and staff about, oh, this is a big deal. This is a big deal. This is the, this is the whole, you began to see that if you're in public health and communicable disease is sort of the core of what many see public health as, I'm like, you know what? It seems like our World Cup is here, and that
Hmm.
somehow we've ended up in something that doesn't happen every year, but we're supposed to be playing at some level, keeping ourselves in shape. And guys, it seems like this World Cup is upon us. And have we had enough training? No, are we conditioned to be ready for this? And so we began talking like this was this is what lots of people in public health train for, and healthcare, although a little bit differently in healthcare given the breadth of disease and stuff. But it was Seattle that got our attention.
Mhm. And are you referring to, when you say are you referring to the health department or the North Delaware Health Alliance or both?
It was both. It was the health department from, if there is a World Cup for us, it's communicable disease. So we're going to be confronted with recommendations and actions around how do we protect the public and how do we combat this thing that we know very little about, other than that it's a coronavirus.
Hmm.
On the other side, sort of on the Health Alliance side, it was, this is going to impact people significantly. And what do we need to be thinking about from a community perspective that may not be the typical, it's about a communicable disease, but it's about the impact on people's lives. And so what's going to happen with all of those things that we try and do that we know are going to be impacted? What's going to happen to people's housing stability? Are we suddenly going to find people who, are going to be displaced? As we started to learn about the kinds of tactics we were going to have to use with, really closing down in ways, we knew that jobs were going to come at risk. We knew that people's stability, for folks who are vulnerable and struggling with those social influencers of their lives, from access to food and transportation and all of that. So it was happening on both sides, although predominantly trying to get ready inside what I do in public health and the people that I was around all the time in public health, and really beginning to then have one of the things that in the public health side I was really fortunate is there's a very strong network of directors of public health,
Hmm.
and so being able to be with seasoned people. We have an interesting mix in Colorado of some very seasoned people who have been in it 20, 30 years, and some very, strong up and coming young leaders. And those conversations started to pick up as well, so our calls with each other that we really formalized and said, okay, every week at this time, we're going to have a conversation about what we're learning and what we're bringing to the table. So that all began to pick up, as we got through January, started to get to see what was, really materializing in February. So a lot of conversations, both internal with colleagues and staff locally, and then on sort of the state level for the most part. Some of it involved people at the national level, but a lot of it was the strength of a network of public health leadership.
So that's where you got your best support and exchanged
Yeah, that
information.
Yeah, that was where the information, okay, what's next? What's coming our way? What do we need to be preparing for? Some of it was, as it started to play out and you realize some of the things that were going to be really challenging. I mean, how do you protect the workforce that has no choice but to be around individuals who are
Mhm.
infected? And you start hearing things like, well, wait a minute, nobody can get a hold of PPE. And suddenly public health's in this role of having to jockey all of this PPE requests and like, all right, we got to ride this one through because you've got to get this stuff to the folks in the hospital and the first responders. And, so you're suddenly just drenched in all of these requests where you're thinking people are planning and are we really ready, you know, for
Mhm.
for it. So it started off being very logistic in some ways, but always focused on what do we know? What do we know? And what are the things that we're learning from these other communities and other countries like China? And it was also a place because we all, I think at some level, I mean, it never leaves our minds because of this structure of public health. It's largely governmental in its organized fashion. I mean, public health is really influenced by everybody all around, but the folks who sort of step up are the governmental entities. And so we knew because it's been on our plate forever that there is nothing that involves bold steps where we knew we weren't going to face political conversations that were going to be huge issues for us, that we were going to have to be going to our elected officials who give us the money to do our work,
Mhm.
and present them recommendations, and that it was going to, we were going to have to be kind of organized in how we put our best thinking together on this. So, that's always been in the background, and over time it was a fascinating part where you could just sit there and realize that you're weighing these things about what is your presentation going to look like when you go to your local people, and
Mhm.
you're like, okay, I've got to take this and make it something that makes sense in Weld County for public health, and what is that going to look like? And and really a big part of the director's conversations was almost like a support group, you
Yeah.
know, as we all need when we're faced with these kinds of situations and decisions and all of that. So that began to pick up, and was really fortunate that Colorado has the kind of public health. Sadly, many are no longer here, but
As,
in their officials.
I don't know if you recall, but I was acting medical director at the health department for 8 months between Joe and Randy.
Oh, that's right.
And one of the
That is
best
right.
things about that, so that was early 90s, I think.
Yeah.
One of the best things about that was getting to know the group. I agree, it was a great group. And
Yeah.
I was toying with the idea of going into public health, and that was convinced me I didn't want to do it. And I mean, it was the politics. Now, you know
Yes.
politics, and you can
Yeah.
do it. But I understand, what those challenges are, and
Yeah.
especially in our rural county, or rural
Yeah.
flavored county, uh,
Right. Right.
where you just have people who kind of, you know, don't get it, don't,
Right.
um, not that they're dumb, but it's not part of the
No.
culture.
No. And none of us, had really any of our elected officials who run on a platform of health at the local level. They
Right.
just don't. They just, it's not. They're always there for other reasons. I mean, they're running on platforms of, boy, it's economic development, and do we have enough roads and bridges, and those kinds of things. So it's not as if they're stupid. It's just their whole experience and
Right.
running and doing their day-to-day jobs isn't really about, oh yeah, you talk to us about these little things from time to time about restaurant inspections for food safety, and we listen to you when you talk about people getting rabies from picking up bats that are rabid, and kind of cute, that
Mhm.
happens and what you do. But something this overwhelmingly health and linked intimately to economy, but not in the ways they are normally engaged in a conversation about economics and vitality of communities because of economies. So fascinating place to find yourself, even though you're used to dealing with political officials. It's different when suddenly they are not the experts,
Mhm.
and others are coming in trying to get the attention in the midst of all the things they're normally worried about, with economic development and what's happening with this industry and that industry and what's going on with the roads and is there enough transportation around and all the things they hear from their constituents about.
And these seem to be rough days in general for experts.
Rough days for experts, definitely. It was fascinating to kind of internally, the team that I worked with of epidemiologists and disease specialists and all the people on my team jumped in and did what we would do. I mean, we started using science, we started seeking information, we wanted to learn from who had already experienced this and what did we know. And so that part felt really good and really comfortable and gave you sort of an energy behind it, because you're suddenly finding yourself about to, you're about to get in the game. I mean,
yeah,
you're
in the
going
World
to get
Cup.
in the game in the World Cup. And you're like, geez. So that part when those conversations started having, the planning, the getting ready, understanding, that part felt good internally because it's with folks who value science, understand science, value data, value health issues, and the basics of how do you prevent the spread of a respiratory-borne illness. Right away, it got weird when you're trying to grab the attention of people who are then going to help you fund what you're trying to do and prioritize, because you're going to need resources and you're going to have to say, okay, this is potentially going to be a big deal here. And so even beginning to frame it in ways that made sense. And you quickly could see, as we got into certainly cases in Colorado in March, where it felt different for these folks in elected policy positions, because they're like, all of you guys are coming in here and talking to us and telling us what to do in ways that feel a little different. I mean, it's not like you're giving us some guidance. You're basically telling us these are the steps we have to take right now to do stuff. And so you could see where they were at and trying to figure this out, and how much rope do they give away, and let you go out there and get out in the yard and do, you're on the field and doing what you need to do. So it was this constant dynamic of internally lots of the kind of health related expertise you wanted, and then really trying to frame things quickly in language that would matter for elected officials.
Right. And we did have, of course, in our city in Greeley, we had huge number of cases and deaths.
Yes.
Especially at the meat packing plant and at the nursing homes.
Yes. Nursing homes. Yeah. When it really picked up, I would get calls from the hospitals and from the docs who were being inundated at that point in time. And they were desperate to have some prevention work going on the outside, control this. I mean, there's nothing we can do when somebody is this sick that they need to come in the hospital. And some of them are going on ventilators, and we're not doing a great job even on ventilators. And so those calls would be there where you're getting that, and certainly as physicians, we understand what that pressure is like. You're like, oh my gosh, admitting somebody to the ICU with very little knowledge of how to, even other than the basic principles of how to intubate somebody and try and ventilate them. But those calls would start coming in, and just the sense of, we are really hitting a crisis point. And they began to see those touch points before we could see them, because they saw the JBS employees who were coming in and they're like, Mark, we admitted another 32-year-old last night and he is intubated and on a ventilator and doing poorly. And he's another one from JBS. And what can we do? So reaching out desperately to say, Mark, this is what this picture looks like. And can you help us in ways that we can't do? We don't have time to go sit with JBS. We've got to take care of the people in front of us. And so as they began to highlight these places, the nursing home challenges and the JBS staff, it got busy like overnight. We just found ourselves in these constant need to try and keep up and react to JBS, and then it's like, oh, all these nursing homes, and seeming to get in and spread really quickly in a place where you would, at first you're kind of thinking, well, nursing homes are under all these regulations and they've got all this infection control, and certainly they're not the place. We can understand a large employer who's got people working in conditions that are pretty close together and not a healthcare facility. So we were pulled in so many directions very quickly. Hospitals and saying, you've got to help us. We've got to stop this spread. Now you've got to investigate all these nursing homes, because you're like, well, these folks are going to die. They're going to die really quickly, and they're going to shut down, which is going to compromise the hospital's ability to send people out when they're ready to go someplace. And then you've got a very large employer that, as we all learned, was very well connected nationally. Really struggling to adapt to a new world.
Yes. So do you feel like you were able to have some impact at the nursing homes and at JBS? Did you?
Yeah.
How did you do it?
Yeah. Yes, we did have impact. Yes, I had impact. Yes, the team had impact for a variety of reasons. What we did is we had to sort of divide and conquer a little bit. So luckily, here in Weld County, I was able to build a team of just really top-notch epidemiologists. And when you're in this crisis of doing nursing home infection prevention, trying to shut this thing down and break the transmission, those epidemiologists ran with the nursing home side and got right in there, got in with the state, got in with the folks who run the nursing homes, reviewed their plans, we're testing, we're isolating, we're cohorting, we're doing all the things that you do inside nursing facilities. And so that part, that team ran with. It's just like, okay, good. I got the side that was, Mark, you need to have the tough conversations with JBS. You need to find out what's going on. And you need to, so there was a period of time when it got so crazy that I actually spent 2 weeks operating basically in isolation out of the hotel downtown in Greeley. I had a room that I never left. I had my computer, my cell phone, and I was there. And what I did all day long was phone calls with people. That included briefings for elected officials and briefings for my own team. But I was pretty much in a quarantine situation and just hunkered down from, about 6 a.m. until sometimes midnight at night on phone calls with various groups. So I started having conversations with JBS, and they were not always comfortable. Again, this part of what we started to recognize as directors was those places that we normally look for guidance, like the CDC. And it's like, okay, there's the World Health Organization and there's the CDC. These are the two leading health organizations in the world, and we're looking to them for guidance. And guidance would either be absent or changing so quickly that it's like, okay, I'm having a very tough conversation with the vice president of HR for a large meatpacking company. And every time I turn around, there's a new guidance about what do we do? What should we be recommending for these individuals working in essential industries who got viewed as being that whole phrase, essential workers or essential industries, sort of, some people took it on like, it's okay if they're exposed. And I'm like, no, it's not okay that they're exposed. Yes, hospital workers are essential. Nobody's telling them to go work without a mask. Right. They're saying we're going to protect the worker. Yes, we recognize they're going to have risk, but we're going to do everything we can to protect them. That conversation is really easy to have inside a healthcare organization where they're like, yeah, we're risking our lives. You're trying to come over on this other side and say to a company, yeah, I get that everybody wants you to stay open, that people need food to eat. There's still things we have to talk about. Your employees are showing up in clinical situations that they're desperately ill. And this is where those weird breaks in this conversation about economy. We have to remain open. We have to remain open. We have to remain open. And I'm like, all your people are going to get sick and you're not going to be able to remain open
Mm.
unless you take some measures to do these things. Yes, they're going to be hard. Yes, they're not. You're going to be faced with having to do things that you've never done before. But the choice is to let this thing play out, and you're not going to have any workforce anyway. They're either going to be dead, or they're going to be in the hospital, or they're going to be sick and spreading it to each other until it's gone through your entire workforce and the plant's closed anyway. So lots of really tough conversations. The balance here, and it's sort of the lessons that are really hard, is there were authorities that health officers have. You know, you can quarantine people,
Mhm.
and that's in statute, and you can issue orders. And this approach to try and say, I don't want to come on as the heavy hand of government. I don't think that's how we get a lot of work done. We got to come in with some sense of education and getting people to more voluntarily comply. Not that I'm opposed to having the quarantine right, but having to balance this conversation to educate JBS. Say, look, it is in your best interest to do these things. You got to change how people come to work. You can't have any perception in your employees that they have to work while sick. What are you doing with your benefits to be sure they can stay home so that they're not pressured to come in? Can they really quarantine at home? I mean, if there's 11 people living in a 2-room apartment,
Mhm.
there's no quarantine going on. Those 11 people are going to get sick, and half of them are your employees. Those conversations were balancing trying to get inside the head of JBS. I remember at one point, my main contact he kept saying to me, Mark, you don't understand our industry. And I'm like, I don't have to know how to run a beef processing plant. That's not my job. That's your job. Your job's to run the plant. My job is to come in here and tell you what protections you have to put in from a health perspective if you want to keep your plant open and running. So don't yell at me about understanding a thing. None of my staff are going to understand what it takes to run a beef processing plant. So stop yelling at me and it's also not my job to run your plant. It's not my job to run your plant. My job is to prevent spread and having lots of people die and end up in the hospital, or end up in the hospital and die there maybe. But so the whole thing was this. I took on the sort of toughest conversations to try and educate people and implement best practices, and then use the authority in places where we just ran up against a wall, and
Was
had
the
to say,
plant shut down for a week or two?
yeah, it did ultimately get shut down for a couple of weeks. Um, it was one of those where technically it was a voluntary shutdown, but
Mhm.
by that point the state was involved. I had issued a public health order. We started having, you can learn very quickly how a company like JBS can be very well connected at a national level. I mean, they're an international company, but with, I forget how many states they have processing plants in, between pork and poultry and beef and who knows what else. But all of a sudden you're learning that the vice president called the governor and is talking to the governor about what's happening in Greeley. And you're like, okay,
Mhm.
and one night I'm trying to brief commissioners, and one of the commissioners dialed in Cory Gardner, Senator Gardner. And I'm like, oh, hello, Senator. So these conversations ended up from national to state to local constantly and evolving. Well, just every minute of the day, something was going on. But we did make a difference. I mean, I have to give it to, when we got to the point where it was clear to JBS that they were not winning this. I mean, it wasn't working, and they were not going to have a workforce. And one of their other plants, I think it was a Tyson plant in some other state, was about a week to 9 or 10 days ahead of JBS in the outbreak. And they were realizing it. They had 250 employees out at another plant, and they began to recognize, and I have to give them credit, that when it came down to the really toughest conversation, they had the CDC. We got the CDC here. We got NIOSH here, so National Institute of Occupational Safety and Health. They had consultants they had hired from CU, from the School of, I think, Medicine, in sort of industrial hygiene or something like that.
Mhm.
And so they really did try and learn. I mean, and they didn't always welcome folks to be in the plant at first, but the consultants came in, the federal teams came in and went through there, and ultimately arrived at the plant closure where JBS said, let's just close it down. Let's just get it done. A lot of back and forth about the value of testing and confusion over testing and quarantine and all of that. But a lot of lessons were learned about working with a large company that is in the essential industry category and is filled with, a mix of employees, some who speak English, some who have lived in Greeley forever and are multi-generations working inside the company, others who are new, refugees, and don't speak English or Spanish, and you're trying to culturally be certain they understand what's going on. So it was a fascinating period of time to learn how to work with industry so closely to get a result that was.
And I understand, I think it's happened since you were, it has happened since you left your job, but there's been a resurgence at the plant.
Yeah, it's interesting. I don't know directly all the details anymore since I'm outside of it, but I suspect a part of what happened in any large company, but especially one like JBS, and it's happening, I think, with society in general, is this fatigue. So they put in all sorts of measures. I will tell you that by the time they opened, they had totally adapted their entire process for bringing people to work. They had moved, out into the big parking lot. They had tents, they had screening, they were, getting people siphoned off. They had put up guards inside the plastic material guards between the workstations. They had totally revamped their operations. I think it's hard to sustain that. I mean, I think it's hard when you're suddenly like, oh my gosh, it takes forever to get a shift change for JBS is something like 800 people having to enter the job site. Well, slowing them down and getting 6 feet separation and still getting the shift to start, it's, they did dramatic things over time. It began, I think, I suspect it broke down the same way people's precautions personally began to break down, and people were like, I'm going out. I don't care. I'm breaking quarantine.
And speaking of resurgence in general, I just read in the Greeley Tribune this morning that all of a sudden the economy is taking another nosedive.
Yeah.
Which is no surprise with resurgence of the disease as it is, but.
Yeah, no, and that was one of those subjects about the direct connection between to say there will not be an economy if we don't control coronavirus. Some of it will be those of us, I'm not going to go sit in a restaurant and eat with people who are right on top of me with no masks and in there for an hour and a half. I'm not going to do it. I'm not going to do it. I'm sorry. You don't have to mandate anything. I'm not going. I'm not going to go there. Workers are going to be sick enough that part of the thing that's happened to some of these small mom and pop operations, if you have 5 team members and 2 of them are sick with coronavirus, well, how are you running your business? I mean, even at a scaled down version, how are you running your business when half your team is out and the other 3 were exposed and probably have to be in quarantine? So you got to shut your business down for 2 weeks. So this direct connection where it's about the economy, and if you want to use those phrases from the past, it's about the economy, stupid, or it's about whatever, stupid. Those were some of those blunt conversations sometime about, it is about the economy, and health is directly affecting the economy. And some of it will be mandated. Yes, we'll have to shut down, but without healthy people working, people who feel confident that it's safe to go out, there is no economy. The US economy is 70% built on consumer spending.
Right.
So an economy that is 70% consumer spending and no one has confidence spending their money because they don't feel safe going to the places to spend their money, they can order some things online, sure. But we spend a lot of money on things that take us outside and go someplace else, So it was fascinating to watch and to now see it playing up, these states that were really, let's go, let's reopen, let's build the economy. And it's not working. It's not working. In fact, we're probably digging a deeper hole.
Well, 2 of my kids live in Arizona, and recently canceled.
Oh, wow.
They just recently canceled the
Huh.
trip here because it was looking like it was going to be okay. And get to see
Yeah, yeah,
my granddaughter there and stuff. And
yeah,
it just, they decided, and I encouraged them not to come. It's,
yeah.
it's terrible. What's going on.
Well, it is. I mean, and then just watching the toll on families. This is where more of the side of it on the alliance, where we could see the toll that was taking on families, especially those that
Hmm.
worked at JBS and had people who were sick and in the hospital and now worried about rent and saying, how can I quarantine? How can I be away from people? And just watching the toll that it took, on
Hmm.
families. And then as nursing home had to go into lockdown mode where no visitors,
Right.
and my mom died a year ago, in May. And I have to say, I'm so glad she didn't have to, because at the end of her life, she had spent her last 6 weeks of life, in a nursing facility because her dementia had gotten really serious, that she couldn't be managed at home anymore. I can't imagine her fear, and our sense of helplessness if she had been locked in a room for those 6 weeks with nobody visiting except wearing all of this protective garb. My mother would have been just
Yeah.
totally scared and confused about what was happening. And so, began to hear these stories about these patients who had been these nursing home residents who hadn't been out of their room in weeks and weeks, and what I'm assuming many of them had enough awareness to know people around them were dying and being taken out. So, those stories started coming in where you then feel that pressure. And then you'd get a call from a colleague going, Mark, the ICU is full. And you hear your colleague desperate for help and fatigued and scared. And you're just like, how do we get through this? There are those moments where you just felt like, is this it?
So how have you gotten through it?
um,
I mean,
I
I
got
know,
through it.
dedication, a sense of purpose, but
Yeah, but no, it had to be more than that, because clearly I was going to do my professional role, and I was committed that we're going to get through this. But like I said, it took many of my phone calls with colleagues and with each other. It was that support group that we needed to say, how are we doing? What's happening when the threat comes into you because you're making a recommendation that somebody doesn't like? You grow a little bit tolerant. I remember a year when somehow I got associated as if I was trying to destroy the stampede because I said something about chew tobacco, and I get threats on my voicemail about, you tobacco Nazi, we know where you work. And I'm like, well, sure, you know where I'm
well,
work. Yeah.
just as an aside, when I had a practice in rural Wisconsin, which I did for 5 years before I came to Greeley, and
Yeah.
I had a column in the newspaper, as I did here, and I wrote something about lactose intolerance.
Oh,
And I had some I had a dairy
yeah.
farmer actually call me a communist.
Oh, yeah. Oh, yeah. Oh, no, there was something one year we were trying to promote more fruits and vegetables. So we
Uh,
got a grant, we got money, we put up billboards about, fruits and vegetables.
right.
The cattle people called and said, why are you anti-beef? And I'm like, where does that sign say anything about we are
Right.
opposed to meat? None of us have said a word about meat. Well, they're like, well, you're only promoting vegetables. I'm like, yes, it's a vegetable campaign. People need something to eat with their steak, but they were all over me again. I'm like, oh my goodness gracious. So part of it was having good colleagues who could serve in a role of both personal counselor and
Uh-huh.
how are you going home and sleeping at night? How are you clearing your head? One of the things I do is I do journal. So I get away and I get to just dump stuff into my journals and say, okay, you will come back and read this later and you'll process it again and you'll be able to put it away. Um, I had to be certain that there was a time, there were times, those days that were going from, 5 or 6 in the morning until midnight, where I eventually had to just say that nobody can live through this, guys. And I remember having to tell, I think it was the state health department one day, that we are not doing this at 11 o'clock at night. We're not doing it. You need to be asleep. I need to be asleep. All of us need to have a break. And having to draw some hard and fast lines in the middle of a crisis to say, it's my time off.
Yeah.
I am gone. I took a break from social media because it just blows up in a way where it's
Mhm.
just too much. And so I had to just say, I have enough information coming at me. I don't need to seek more information. So let me control it and not have to. It's hard once you start scrolling and then you see people yelling at other people. And I couldn't
Yeah,
take the tension of society having this sort of increasing divides over you're stupid and you don't know what you're saying and you're confusing us and you're evil and yeah, okay. So some of those simple things like nope, not touching social media, and then every once in a while doing something that just was really, a way to break the cycle. One day I I used to, when I was younger, the way I made it through my internship was by signing up in the worst year of my life from a time perspective for community college in Santa Monica to do art. I did pottery,
mhm.
um, and that was the only way I made it. I was ready to be done in December of my internship. I remember walking into the program director and saying, "Sandy, this is the stupidest thing in the world. I don't know what I thought. I keep saying I want to be a doc since I was 7 years old. Not this. This isn't what my 7-year-old dream was. So let's just call it quits. My friends getting their MBAs. I'm going to go get my MBA and
Mhm.
whatever." And he's like, "Oh, Mark, you need to step away from all this. You need to do something totally different. What's your next passion?" And it's art. So in the middle of some of this, I would end up. I painted a picture one day. I was like, "Okay, you're gonna you're gonna leave and you're gonna go find some paint somewhere and you're gonna slap something down on a on a canvas."
So
So
what are you
there were
doing
things like
now?
that.
Are you doing any art?
I haven't for a while yet, but if some when I'm in my office at the Alliance, the wall behind me is filled with art that I did.
Oh,
And so what
I wish
normally people
you did.
see on Zoom, I'm not at the office on
Yeah.
Fridays to kind of recover a little bit. But when we're on a Zoom what's behind me is my artwork in my office.
Oh,
So
good. What
I'll be
media
back to that.
do you use?
Just acrylics.
Uh-huh.
It's the kind of stuff that you can do. You can learn from those little studios that want to give you wine and have you come in and
Uh-huh.
learn to paint. So you get a little idea, since I'm a little rusty on, my own ability to look at something and say, "Oh yeah, I can paint that." Back in the day, I'd be able to at least draw it. So that is still back there, though. It's still I'm anxious to get back to. Um, the other passion of my life is reading. And so picking things that got me away from the reality of the pressure all the time. I love historical fiction, particularly the resistance movements in World War II Europe.
Mhm.
So I read a lot. There was this sense of, okay, if they can make it through World War II, being occupied by the Nazis, and these women can, you know, not only go underground where typically that wasn't roles for women, and they can do that and all the other things they were having to do, and stop this Nazi invasion from succeeding in the long term. I thought, oh, all right, you can come on, just pretend to be this little Nazi resistor. So that so that helped. That helped to be able to once in a while just say, won't be the whole book, but maybe you'll get through a few chapters and
Let,
get
let
some
me
kind of.
let me ask you about turn the conversation to more internal challenges.
Mm.
How did your staff what were the biggest challenges for and with them, and how did they manage?
Yeah. Um, the Initially, what they did was they jumped in the way you would expect in a World Cup game. That they were in it to win.
Mhm.
So suddenly, all of the barriers that would normally keep us from innovating and working together tightly as a team just went away. It
Mhm.
evaporated. You could say, we've got to figure this out and we got to do it by this afternoon. Well, people innovated in ways that we usually take months to do. People stepped up and worked long hours. So there was none of this about, well, I'm a government worker, or,
Mhm.
I've worked my shift this week. Nobody was looking at their watch ready to go. Everybody was looking around the room going, we're all in this together. We're all going to take care of each other. we're going to take breaks, but we're going to work long hours. And everybody did it. We were fortunate that we did have the opportunity to, in our conversations, because we were having them constantly, be able to do those checks on each other and say, okay, what do you need right now? You need this, so we would go to each other. I remember one of our epidemiologists, she's just brilliant, hard worker. I've never seen anybody work so hard. And there were days I just had to go to her and say, everything goes down. We're going to make it through 12 hours without you. Okay.
Mm-hmm.
Nothing is going to be that important, but she was so dedicated to it that, you could just see people were so committed to one another and to their mission that they pulled together in ways. People did jobs that were not inside their normal training. I mean, we had people who normally inspect restaurants who are talking about coronavirus and respiratory illness and putting on, N95 respirators to stick swabs at people's noses, where it's like, that's not what they do, but they were excited about it. They were excited about their opportunity to get outside their normal work and say, wow, this is more meaningful than what I see in my day-to-day job. So that part was good. The part that was hard was it did become exhausting emotionally and physically.
Yes.
And the sort of, as you would see the conversation come across, the way it would feel to us was, if you got elected officials who pushed back on you and said, not that far, we're not going to do that. We don't want you to do that. Near the end, we got into a lot of conversations about testing, for example, and we were promoting testing. They weren't that interested in more and more testing. And so those kind of, you're like at the top of your game. It is your World Cup. You are the expert. You train forever. And then you got some referee holding up a red card and telling you to go sit down. And you're like, and that would become devastating when you're exhausted. And so trying to keep people's spirits up who don't normally have to deal with directly having conversations with elected officials about things that are outside your expertise, and having to shield each other sometimes from that, going, okay, guys, this conversation may not go the way we want. And how are we going to handle it? How are we going to not take it personally? And then as it had those tension points where you're like, yes, but in health, we have to have this conversation. I mean, I had to have conversation with folks who were trying to look for other ways through this, where I said, I have to tell you, one of the unique things you have on your team is some of us have taken a Hippocratic oath, and we have some responsibilities beyond this relationship that you and I have as my bosses. I have an oath that I have taken to people, to the practice of medicine, and I won't violate that. I won't violate that, and that may mean that I have to say, I can't do that. I just can't do that. And I had to be comfortable having those conversations. So the fatigue was huge. The fact that this is something, most emergencies that you go into that we're used to are fires and floods and things like that, where there's a defined period of time. We know how long the water was going to run down, the rivers into eastern Colorado, and they were going to rise. You could watch it rise. Okay, flood. Okay, now 2 days later, water's receding, and yep, there's damaged properties and septics have overflowed and animals have been killed. Okay, now there's a cleanup process. This endless part of the coronavirus is, there was no way to get your mind around it in a way that, so we had to be certain we were always taking, small views of the world. It's like, guys, we can't look that far down the road yet, because we don't know that it's going to go away this year. We could spend the entire 2020 consumed by coronavirus, and probably will. And so we had to really shorten our time horizons to not get ourselves caught. And then we had to do the celebrations that humans do, where you have to pause and say, good work, good outcome. Let's do a little celebration, whatever that looks like. Let's be sure we're celebrating and picking out the successes so that we don't miss the fact that good things are happening. We were able to stop more people dying in nursing homes. Nursing homes adapted and innovated in ways, and we could feel good about that. We were able to make a difference in whether it was the communal living situations, expanding the time in the homeless shelter, creating a respiratory ward in the homeless shelter, those little wins where you could say, guys, all that was worth it. And look at what happened when we finally tested everybody in the shelter. We only had 2% of that population infected. Guys, that's a win. That's a win all the way around the table. These are really vulnerable people, and only 2% in that shelter. Guys, you were doing remarkable work. And you're used to getting volunteers to come in and feed people experiencing homelessness in the shelter. You guys are running a respiratory clinic. Guys, you did a good job at that level. You screened them and you masked them and you separated them and you know, adapted how they went to the bathroom and everything. So we had to really stop intentionally and celebrate.
Yeah. So what now for you, Mark? Well, you mentioned the North Colorado Health Alliance, and if you could just give a very brief description of what that's about. And I know that's one of the things you're doing, but where do you see yourself going in the next short to medium term?
Yeah, the North Dakota Health Alliance is a community collaborative. We consider it a public and private joint venture that was formed in 2000, and it is consisting of community agencies that are either directly in healthcare or surround health by things that generate health. So it's hospital partners, clinic partners, United Ways, elected officials, universities, public education, who are around the table to look at how we build thriving communities. And so that work is work I continue to be involved in. We continue to want to make our communities healthy and bring health within reach of more and more people. So we work both from a built environment perspective, a healthcare perspective, a navigation perspective, resource perspective. So that's fun work to still be involved in. We obviously hunkered down during COVID to focus on the impacts of COVID and couldn't do some of the things that we were doing for our own safety. But I am excited to continue to work with a strong team there. And I have just started to provide some medical leadership to Sunrise Community Health. It's a place that
Congratulations.
Yeah, I have been on their board for a long time. I remember when I moved to Greeley and took the job at the residency that I had a conversation with Dick Stenner after I had settled in a little bit, and I was missing, I had in Santa Monica, one of the things that we did was we served at a community health center. It was a lookalike at the time in Venice, the Venice Family Clinic. And I was missing that kind of evening work. And Jim said, why don't you go work for Sunrise? And I'm like, oh, who are they? So I started working for them in the early 90s, going down at night. And so I've known Sunrise for a long time, served on their board for over a dozen years, stepped down from their board to take a break, and then had a good conversation about, could I come in and help mentor up and coming medical directors as part of my role to help folks navigate through this, the evolving system of care and help medical professionals, PAs, physicians, to build their leadership skills, to work inside the health arena, but also the policy and leadership arena, provide clinical support to Sunrise. So that's something I'm doing part-time right now. But it's been exciting to jump in over the last couple of weeks. So it's a lot of fun. A lot of fun. Good team of people.
Well, it doesn't sound like you're running out of gas.
No, I got to get a break enough that I got to take care of some things I'd put off. Not all that worked out exactly like I wanted. The whole thing with getting my colonoscopy done and having an aspiration is not exactly fun, but I got to experience, okay, how does the healthcare system work when you go in for your overdue colonoscopy and you've got an anesthesiologist and, everybody watching you, you still end up with an aspiration. And I thought, it's that damn mask. They're having to monitor patients who are wearing a mask, because we have to wear a mask, during the procedure. And so there I am. And, and we had talked, I said, look, I'm a little vulnerable to gastric reflux, partly because what COVID did for me, my youngest brother and I talk about, 19 didn't come from the year. It came from the 19 pounds you put on from not being able to go do the things that keep you from putting on 19 pounds. So, I'm like, guys, I've gained about 20 pounds and I have some reflux. So be careful when you get me on my side and bend my knees up and, put me to sleep. And sure enough, I wake up with a mask full of
Yeah.
gastric fluids and in my lungs. So anyway, but I got to rest, which was really important. Getting to be away from the day-to-day work just long enough, just a few weeks makes a big difference. So
Yes, it does.
yeah.
Well, good. This has been terrific. Thank you.
No, thanks for the opportunity.
Is there anything else you'd like to say? Keeping in mind that, who knows, like I said, maybe your grandkids will want to watch this too.
Yeah.
Is there anything else you'd like to insert?
Well, the part that I continue to put my hope in, and these are the things that, number one, I was super impressed with the way so many either people, organizations innovated. I love to see innovation, and I saw people drop those barriers to innovating. So learning to adapt quickly. I feel really remarkable to have learned how folks could do that. I'm just jazzed by the fact that there was a lot of innovation that happened to survive and get through. And then I have to tell you that while there's a lot of animosity and fracturing of society for political stuff, the compassion and caring overall was a lot of what carried me through. You know, when you would work with people who really care,
Right.
really want to stand up, that are going to be those, you know, ports in a storm, the rock in the river, and they're going to be those places, and they're full of compassion. I found energizing. That if you could put aside the screaming at you for being stupid or lying to us, a lot of people were truly caring, and what people did to care for each other was remarkable. And I have hope for that. So
yeah, I do too. I really believe that it's not all going to be better by any means, but things are different.
No.
We've taken a step. As a society, we've taken that step back.
Yeah.
And it's been good for us in that way.
It's been good for us. Yeah, absolutely.
Yeah.
Absolutely. So.
Well, Mark, this has been a pleasure. Thank you so much.
Yeah, thanks. Yeah, it's good to see you.